our patients, we enrolled 20 people to this study, and we unfortunately were only able to include 19 because one patient had a concomitant diagnosis of West Nile virus, which also has cognitive symptoms. So they had to be excluded. So our patients came to NIH Clinical Center for 3 visits where we did a complete evaluation, mostly of their blood vessels, not just their brain, but also systemically, to see what was going on. And then we also obtained samples to be able to do those in vitro disease models, which are still ongoing. And so you can see that the patient population is pretty equal, male versus female, and their risk factors are pretty much in line with like most American population risk factors. So we looked at smoking, hypertension, that kind of thing. And a lot of them did seem to be on mood medications to control anxiety and depression, as well as migraine medications. And some of them were trying to control cholesterol and bleeding, for example. And then when we look at our patients, as far as their particular Notch3 variants, they're sorted here by like kind of age group. But you can see that the Notch3 variant is across the entire gene. There's really no, like they only happen within this portion of the gene. They kind of happen everywhere. And as we did the imaging by MRI for patients, we can definitely tell that this is CADASIL just because of where the white matter disease is and how it looks. But we're also working to be able to quantify the volume of white matter changes in people with CADASIL. And so these are images across 3 visits for a patient that never had strokes. And these are images for another patient who did have strokes, an acute stroke at this stage between visits 1 and 2, and you can really tell the difference in the quantification, which is this like red mask on top of the white matter. And then that settles down a bit by visit 3. And between visits 2 and 3, there were 2 acute, subacute strokes right after visit 2. So there was a lot going on around this time of visit 2. And then it settled, so from acute to chronic at visit 3. But you can still see a progression on the white matter disease if you look at certain areas of the brain. So we're trying to make a consolidated method for quantifying those changes so that people can track how the disease is progressing over time. And then we've also measured something called pulse wave velocity. And I believe this is a test that can also be done clinically. But pulse wave velocity and pulse wave analysis allow you to measure how elastic or stiff blood vessels are like throughout the body. And so we find that in CADASIL, it's this line in blue compared to the line in black, which is healthy controls. People seem to have blood vessels that remain more elastic. So you would expect that blood vessels stiffen over time. That does not happen to patients with CADASIL. So as people age, it's common to have this happen. And we see that there is more elasticity in the blood vessels of people with CADASIL. So there is a systemic effect. We don't know if that is because indeed the larger blood vessels are also affected, or if this is a function of like the peripheral blood vessels being affected, the smaller blood vessels being affected, reflecting on that central measure of like the larger blood vessels. And when we look at neuropsychometric testing, we do see that a psychomotor domain, for example, is more affected in patients with CADASIL than other patients with, say, mild cognitive disease or even Alzheimer's. And also their balance seems to be a little bit different as well. So with the extension of the study, we are hoping to generate more concrete phenotype-genotype links. So we're hoping to be able to say, when you have variants that are within this portion of the protein causing these changes, it actually leads to, say, more cognitive changes in this domain, or less chance of stroke, or more migraines instead, or even maybe there is a difference between males and females as far as migraines and stroke risk and things like that. So we're hoping to understand those links better with the genetics and the symptoms that the patients are presenting with.